Good afternoon, folks. Hope you're good. I'm just going to click a couple of buttons here and get going. I'm trying a different little orientation today because I'm trying to cast this onto Instagram if I can get this working. I'm Jack Chew, and this is Will Alty, Chew's Health. I'm a physiotherapist working from Timperley, and I've been streaming for a long time now, doing interprofessional work. And so we're trying to then get our information out there to you, the general public who suffer with pain and injury. And we treat and manage various different conditions and pains here in our practice. And so we wanted to try and educate you guys on some of the myths and misconceptions around that and around pain. So first and foremost, today I'm going to cover back pain. It's something that's been, this still is the most common injury and ailment suffered for by the public across the world, across the country. And unfortunately, we have our own problem here in Timperley and Altrincham as well with back pain. And so it just, there's, unfortunately, because it's common, it means there's common misconceptions and myths that exist around it, both what it is, how to deal with it, how to treat it. And because it's so common, it means that you often have friends and family members or yourself have encountered and experienced episodes of back pain or might continue to be going through one now, or it develops into a condition of which you need to then manage ongoing. And therefore, because it's common, it means people have often struggled with it for a long time and therefore develop their own sense of understanding of something that can be sometimes rooted in a misconception from given to you by other professionals, or that you've developed an understanding that might not be necessarily accurate. And so I wanted to just make sure I clarified that. And it seems to be something that when I've been asking patients as to what they think I should cover on these sorts of streams, that's one of the things that's come up really is back pain is so misunderstood. And that's sometimes patients of mine saying that until I went through a process with you or worked through an understanding of my situation, they kind of they felt that they were misled and misunderstood, and they feel that family members sometimes are in a similar boat when someone injures themselves. So one of the things I wanted to cover is that the types of injuries that people experience. You can get aches and pains and sprains in the back for all sorts of reasons. But one of the things that is really sensible to start with is that much like you can pull a muscle or sprain or strain yourself from a sudden or sharp movement, you can develop that in your back, and that's a common thing where you twist or you pick or you extend or you reach for something and you tweak yourself, and you can pull a muscle, you can sprain yourself. A sprain typically is considered a ligament sprain, a muscle strain, and that's sometimes why those things are sometimes used interchangeably. So you sprain your ankle, but you strain your hamstring. It doesn't necessarily matter, usually based on the fact that more force goes across a joint or muscle than it can tolerate, and therefore you get a sprain or a strain. And so the back can suffer under those as well. But one of the things you might have noticed if you've ever had that or you've spoken to professionals about it is that they're sometimes reluctant to identify exactly what structure it is. So if you sprain your ankle, someone might talk about which ligament you've sprained or torn. If you pull your hamstring, for example, people will be saying you've pulled your sprained or strained your ankle. Your hamstring. Whereas in your back, they'd be more reluctant to say that. The reason for that is because it's a very complex interconnecting web of different tissues, different muscles, different ligaments, and I'll come to discs in a second, a quite unique part of our anatomy there. But one of the things that's really important to reflect on is that when you injure your back or you sprain your back or strain your back, you just have a bit of a back pain, even if you can't recall a particular moment or incident, then the interplay between the joints, the discs, the ligaments, the muscles, the nerves even, is something that there's no specific assessment or scan or test that can be done that would identify which of those tissues is the core driver of this problem, the cause of the problem. And it's been hoped and thought that we could do that. You know, as professionals have gone through phases where we thought we could, or we had a series of tests, or we developed the extrasensory skills through our hands to be able to identify and push on exactly what it is that's hurt or broken or torn, etc. And we found ourselves wanting. And so the more we study that scientifically, the more we realize that the interconnecting, the interplay between those different tissues is far more complicated than we once thought. And so it's not that there's this test for muscle, this test for joint, this test for ligament. So when someone develops a back pain episode, a far more important thing to think about it as is, instead of which part of me is damaged and therefore how long will that take to heal, what we've come to realize is that the development of a sensitive pattern of movement that you don't like, if it feels uncomfortable to pick something up from the floor, or it feels uncomfortable to lean back and reach for something overhead, or it feels uncomfortable to walk or run, the functional impairment that you have that is specific to you and what you're struggling to do that you need to be able to do is far more important than the specifics of what tissue you might have injured. Another reason why we are away from that side of thinking for back pain is because we've come to realize that the more we scan and x-ray people as part of our clinical studies, we've come to realize that people can have things that might get picked up on scans that aren't particularly relevant to their symptoms. So they might have some wear and tear in parts of their back, or some or even muscle tears if you do a superficial ultrasound scan, that then might be on the opposite side to where it hurts. These things don't necessarily correlate with symptoms. They don't necessarily then mean that those damaged parts are relevant to the pain that someone's experiencing. So if you recognize that you're finding things that are broken and damaged that aren't in people that don't have pain, and then you also sometimes find things that, squeaky clean scans in those that have got pain, then it tells you that pain is something more complicated than just tissue damage or injury. And so that's something that people sometimes get misunderstand, that when we're not necessarily giving them a specific structure to hang their hat on, and then this is how long it takes for X ligament to heal, and therefore the healing of that is what will get you better. The reason we're not doing that, at least anymore, is because we know that can be wholly inaccurate and mean that if you were to obsess over how can I heal that ligament that I've just torn in my back, the way in which you might associate that with a sprain, of which, well, it should take 4 weeks for that ligament to recover and remodel and things like that. It just doesn't work like that. Healing timeframes aren't like that. And also the healing timeframe isn't relevant necessarily to the pain alleviating. And that's the most important thing. That's what people are bothered about. Can I get back to doing this thing? Can it hurt less? Can I sleep better? Those sorts of things, which is where the most important thing is. So when we think about the causes of pain, start to try and think in terms of what your back can't tolerate certain positions, activities. It's become sensitive to certain positions. Now, some of that sensitivity is contributed to by sometimes elements of areas of your back that you might have damaged. So I'm not dismissing the fact that might matter, the structure might matter. But as I've mentioned before, the recovery of those tissues is not necessarily the thing that's central to your recovery and this being more comfortable. So instead, be thinking, what is it that I need to do with my body, and how can I achieve that? Can I break things down? Can I start to gently expose my body to the right types of movement? How can I get myself out of any bad habits that might assume because of the pain? So it's not quite the same when you sprain your ankle. You sometimes will limp on it for a little bit. With spines, it's sometimes difficult to assume a movement pattern that can be comfortable. It just hurts all the time. You can't take any pressure off it. Or that people sometimes will overindulge positions of which are more comfortable. Now, it hurts to walk, therefore I'll sit, or I'll take myself to bed. I'll rest for a couple of weeks. And essentially what happens then is your comfort zone, your ability to do things, becomes smaller, and that becomes a much more challenging thing to then get back up and get going. So the general rule is that you keep yourself moving, you do what you can, but don't suddenly then feel that you try and do everything. Don't return to complete normal work and sporting function if it's really uncomfortable to do so. But generally speaking, try and keep yourself moving and try and work through it, because it's something that really, the tissues of your back are incredibly strong. They might feel weak and they can feel very sensitive and very vulnerable when you've had an injury or you're struggling with a painful condition, but they are not as flimsy as they might think. And that's one of the things that you might think and they might feel. So one of the things I wanted to come on to is that the discs and the nerves local to the discs can get a bit of a bad rap. Your discs cannot slip, for example. We've had a term in our culture of slip disc that has been it's haunted us therapists and doctors for many years now. Discs are incredibly robust and strong structures. They do not slip in and out. They don't pop in and out. It might feel like that. Like, I'm not doubting that that's how it might feel. It might be that that's been something you've been told, and that slippage is something that you've associated with, because when it's a certain position, it can then feel like a sharp pain, and that's that disc slipping out. They are completely really strong tissues They're not slip in and out. They're not hockey pucks under, between greasy hockey pucks that are slipping in and out of anything. Discs can bulge, and the bulges can then give pressure to nerve roots that can give things like sciatica and other elements of leg pain. So I'm not, again, suggesting that these things can't happen, but the specifics matter. Your back is a really strong structure, and therefore it's not slipping in and out of position. And those bulges aren't popping in and out like a water balloon. They are incredibly strong, incredibly robust. When a disc bulges, it can then encroach on the nerve, or it can irritate the nerve from some inflammation around that area. But apart from in circumstances where that then is compressing the nerve, of which we, of course, would then test for, you're then in a position where it really can, your body will and can acclimatize around that bulge, as well as the fact that, like a swollen ankle, a swollen disc bulge can then retract and regress over time, and give space for that nerve to pass and move again. And so discs aren't narrow, specific causes of back pain. They can contribute to it. They are relevant things for us to consider, and they are injuries. They do get injured and they can be treated, but they are not necessarily the central issue that people sometimes think they are. People have sometimes got family histories of disc problems. And they perceive themselves and their backs to be then fragile and vulnerable. And it's a really common narrative, a common understanding that people have. And we're working through that every day with people and helping them to realize that they are more robust and they are more capable than they might think. Because one of the things that happens when you feel very vulnerable is you start moving differently, you start holding your breath, you start avoiding reaching to the floor. People will say to me, the floor feels a million miles away from me now. Those sorts of habits are really tricky to try and uncouple, but that's what good therapy can do. And so I wanted to cover the fact that then injured tissues aren't really the central issue, that the way in which to think about pain is thinking in terms of your current tolerance to your current routine and function. So your body, your back, your system has become sensitive to certain movements, positions, activities. And that process of working through and understanding what to back off for a bit, what to work into for a bit, helping to keep yourself moving so that then the body is a system that can then adapt to any injury, ache or pain that it's developed and move and work through that. That is a better way of thinking about these things rather than it being what's damaged, therefore what time frame does it need to heal and how can I heal that better. There are elements of healing that are always occurring within our bodies, and as long as we're relatively medically well, then there's absolutely no reason that healing would be compromised. Instead, it's about trying to create an environment of which your body can adapt and work through that. And that's what, again, we work with hundreds of people at any given time here to try and help with that, as do many professionals across the world, of course. So that is a modern way to think about back pain. I know that sounds irritatingly vague, and of course, on a stream like that, I couldn't apply it directly to you or your family member or loved one that's got back pain. And of course, a tailored assessment is exactly what you would want to have if you were to try and work through that with specific therapy. What matters to you? Someone whose important goal is to walk their Alsatian around a park every twice a day is different to someone that wants to compete in some sort of elite sport, and is different to someone that is really struggling to even make a living because they need to commute to the office every day. And the specifics of what someone's struggling with are exactly what should be the constituent parts of any treatment plan or pathway that would get you better. But thinking about what is it that I can't do and why is exactly what to work through with a therapist who should become a coach, who should become someone that you trust to be able to help work through and solve those problems with you and explore that functional deficit, as we call it, together. So hope that's been useful. A little bit of an insight into how to think about and how to manage low back pain, an incredibly common problem. If you're interested in working with us, then we're choosehealth.co.uk, or give us a call 0161 871 7391. We're at Timpley Sports Club and happy to help talk through this and see if we're the right people to help you through your back pain issues. I've been Jack Chew, and hopefully if I click a couple of buttons, I'll be all done. I'll see you all next week. I'm going to be trying to do these each week in and around 12:30ish on a Wednesday. All right, take care.